Hello and good morning, everyone. I am very pleased to be here today, and I want to welcome my guest, Carol Lamarche. Today, we are going to talk about a very interesting topic, a topic which is on the mind of many of us. We're going to talk about mental health. So, Carol is an expert with us, and we're going to talk about the mental health from a specific angle. The angle is about how to communicate with our audience online. So please, I want to ask you to join me to welcome my guest, Carol. And Carol, I think I will just let you talk a little bit and tell us who you are, introduce yourself to our audience who are now with us live on Zoom and on our Facebook page.
Thank you, Mark. I'm really delighted to be here. I have a great deal of respect for your work in marketing and communications, and I'm excited about this series, and I'm very pleased to be a part of this.
Thank, thank you. So tell us a little bit more about you. What is your experience? What have you been doing in this area?
Right. Well, um, with my business, Healing Tree Communications, I've been working with a variety of different organizations, from the Department of Health and Wellness in Nova Scotia to smaller initiatives such as the um, Early Psychosis Network
Mhm.
in Nova Scotia to individual researchers. So with these undertakings, I've had a chance to look at how organizations communicate, what they need to do. And I've had a pretty rich education through community involvement and learning from organizations such as the Mental Health Commission of Canada, which is a fabulous resource. And I hope throughout our talk today, we'll have a chance to talk a little bit more about that commission.
Of course, of course, of course. So, Carol, before we dive into the topic, as always, I want to thank our sponsor, platinum sponsor, Agora Office Space, from where we are broadcasting live here in Bedford, in Nova Scotia, and our strategic partner, CIMO, who is the Chartered Institute of Marketing Management of Ontario. It's an organization which I am very proud to be part of as well. So before we go and talk about something specific, let me ask you a question. Uh, why mental health is important? Let us start with this big discussion and big topic. Why it is important and why we need to really take care of it.
Well, health is wealth, you know. So you have to have health. You have to have good health, physical health, mental health, to have a good experience in your day-to-day living.
Mhm.
So the work that we do in our various organizations, as we're communicating with people, has we have the opportunity to support that and to make good circumstances for people. And so that's really part of our mandate as we go ahead.
Okay, and in terms of your views, how do you think is mental health, or what is the awareness which we have in our communities and around us, whether business environment or friends or family? Do you think really that the majority is aware uh, of their surroundings regarding to mental health, or?
That's a good question. I'd say that over the last, say, 10 or 15 years, there's really been an explosion in awareness and dialogue in the overall community. We had our Mental Health Commission of Canada start about 15 years ago. So they had a 10-year mandate, and that's been extended. So they're in the second phase of that now. And that has really given a lot of tools to organizations, from government to corporations to individual families and people who experience mental health challenges. So with those supports, and that's just one
Okay.
facet of what we see in Canada right now, but we can see that the conversations are really flourishing.
Okay, okay. Yeah, and honestly, personally, if you want me to think a little bit, like 5 years ago, maybe I wasn't really hearing a lot the word mental health being managed and handled in our community, into the business environment, in the communication, if you want. And then recently it started to gain more and more, at least, visibility and interest and importance, right?
Hmm.
And you mentioned government and not-for-profit organizations. So let us first of all divide our discussion into two different streams. At the beginning, we're going to talk about how the professional organizations and the government is helping us in handling mental health through communication. And then we'll have the second portion of our discussion that is going to be more focused towards the corporate environment.
Hmm.
So let us first talk about these NGOs or not-for-profit and the government. So how they are trying to help us in understanding how, we need to focus about communication, how communication, or how important is communication regarding mental health.
It's foundational because that's what we do. We communicate to each other, whether it's person to person or organization to audience or what have you. So the support is growing, and we see that there's a movement towards having people first language. So the idea there is that instead of having sort of an upper level organizational view, looking sort of dictating
Mhm.
how things should be, we are including people more on the ground, and that's pretty much everywhere. We see that in small organizations across the country.
Okay.
Here locally, for example, we have just one organization is the Schizophrenia Society of Nova Scotia. Another is Langhouse, uh, working with youth. These organizations have done a lot by bringing together their resources and supporting the community on the ground. So it really makes a tremendous difference to people um, where
Okay.
they are in their lives.
Wow, that's great. And so when we talk about communication, while preparing for this, and you shared with me some of the resources, and I, let's talk a little bit about this image. And let's talk a little bit also about like the jack.org or the likes of jack.org. I just want to mention that we're not promoting anyone. We don't know them, or I don't know them. I never spoke to them. So there is no promotion over here, but we're taking them as an example. uh, what can you talk about it? Help us understand how these organizations are taking care of uh, of mental health in the digital environment and within their communication.
Well, this is a really exciting organization. Jack.org is named after a young man named Jack who actually died by suicide. And his parents and other people wanted to support youth who were experiencing mental health challenges. They have a really exciting website and they do a lot of great things. They have a cycling event, which this year, because of COVID, has been opened up to people not only cycling but doing everything from knitting and crocheting at home. Just sponsorship involvement, community involvement to support this cause. They've got a great website, um, and
Okay.
as you can see, it's really informed by the youth experience. So youth are front and center in this organization, and that's an example of involving the people who are being served at the heart of what is happening.
Okay, okay. And what really caught my attention is this disclaimer at the bottom. So can we talk a little bit about it? And also when we're looking at some other organizations, we always saw this kind of disclaimer. So how important it is, because we're talking about communication, right? So we need to understand what are the small tips which we can get or give to our audience, and understand why they are important.
Right. So that's a really good point. I would say that falls into looking at how we're communicating, where we're communicating, what our goal is, who our audience is. I mean, there's a big difference between, say, giving some kind of informational tidbit
Mhm.
and actually trying to help somebody in crisis. And organizations are doing those things, all of those things, and
Okay.
but they have to do it appropriately to their audience with the tools and the language and the messaging that they have available. So here, Jack.org has got a disclaimer that says this is not a site for personal disclosure of mental health distress. Um, and if you're in danger, call 911. So that is
Yeah,
a really important point, so that people don't misunderstand and perhaps reach out through an avenue where they won't actually get timely help.
Yeah, I totally agree. And we need to also keep in mind that all these organizations are here to help, but they are not really the ultimate emergency services or emergency call numbers. And we need to keep in mind that they are just here to assist. However, when there is a real emergency, we really need to go to the experts, right? Like 911, or if we have our own physician or anyone who's really following our case, it's better to call them directly, right?
Right. And I think, as somebody involved in communications, you have to know what your role is. So, I myself am not a psychologist or a social worker, but I can be sensitive to the needs of those professionals to help craft and deliver those messages and make sure that they get into the hands of the people who are looking for them.
Okay, that's very interesting. So tell me a little bit, um, what are the tools or the techniques that which governments or not-for-profit organizations um, are using in terms of communication? Like how they are really communicating to us? Is the message getting across? Is the verbiage and the content getting across, or it is all more like big titles and really people are not getting engaged into the matter, into the topic?
You know, um, I'm participating in a nascent effort right now, and it will have a mental health component. It's a social, um, what do you call it? Not a social initiative, I suppose, to provide supports for vulnerable people. And some of the primary concepts there are to relate with the people, the audience that you're serving, to see, well, what are the messages? Because you could actually craft policies, craft messages for
Mhm.
people that aren't actually helpful. So you have to really connect with those people and make sure you know, first of all, who's your audience? What are you talking about? What's your goal? And then using appropriate language
Okay,
and
okay.
platforms and delivery mechanisms.
Yeah, you mentioned something interesting, like who is your audience, right? And then sometimes you need to communicate to the professionals, and sometimes you need to communicate, I think, to person like us, like the citizens, right? The people who are affected, right? And I am sure it is two different level of communications, like, and I know that in general, in the rules of written communication, we need to always keep it simple for the general audience, so that we don't use like lots of technical words or complex sentences and this kind of stuff. Do you have any tips or recommendations for anyone, for example, who wants to either start an organization to support mental health, or anyone maybe from the government listening to us and they want to improve, and they might, for example, reach out to you and say, listen, Carol, can you help me in, or can you help us in improving the content of maybe a website, a document, a brochure, a booklet, whatever. So what kind of level of communication or we can use, so that we can really make sure that everybody is understanding what we're saying?
Well, I would say that probably you're going to end up producing a number of versions of your message,
Okay.
uh, because you will have within a set one audience, you're going to have a variety of groups. I was talking with a woman who worked with the Department of Health and Wellness,
Uh-huh.
and my understanding was that on some project she was working on, they had 14 different versions of a message. And so,
14.
yeah, yeah.
Wow.
So you have different purposes, different goals to accomplish with your message. You have different audiences.
Mhm.
I mean, and if we want to take specifically the example of mental health, you're going to have people in the community out there, people from different cultures with different values, um, different languages, different reading abilities, and uh, different possibly a different state of mental health. Some people coming to your website or looking at your documents might be uh, um, professionals looking for a certain level of information. You might have somebody who needs support, who is looking for help. So if you, for example, I really like this example. If you Google the word suicide,
Mhm.
uh, you will find a variety of kinds of content, web pages, some of which address a whole range of topics around suicide. And then you'll also find in like big 60-point font, like a 1-800 number right there on the first page of Google, are you in distress? Call 1-800, blah, blah, blah. So what a great example. What are you trying to accomplish? It's going to really determine what you write. It might only be a phone number in a huge font.
Wow, this is really important what you said, and it's good that we have organizations, or I would say influencers in the digital environment, and definitely Google is an influencer, and actually they can, uh, if you want to believe what they can do too many things in terms of influencing to the right or to the left, right? Some of the discussions, and it's great that they are putting in place this kind of awareness, right? So that we can prevent anything happening and before it happens, right? And this is one of the key missions maybe of not-for-profit organizations, and definitely government organizations that are handling the mental health topic. Uh, we just got a question here, so let's. So someone asks, most community-based agencies provide services in the context of mental health, although that may not be their primary mandate. Community-based agencies. So I'm just trying to summarize. Carol said around physical health, emotional health, mental health is also part of the individual. The greatest unexpected consequence of specifically to, to date is that people need a compartmentalization rather than recognizing that individuals need. Everyone has mental health. The issue is whether the mental health is healthy. I like honestly I like the whole command, but the last sentence is important. We all have a mental health, right? The question is it healthy? This is a great comment, Marika. Thank you very much for sending this question. So Carol, what can you say about this? Like, yeah, how can we measure the healthiness or the health level of our mental health? Is there like a scale? Like, I know I can weigh myself, I stand on a scale, I know if I gained weight or not. How can I measure if I am still I would say at the normal level of what a mental health should be? Is
I
there?
really love that question because it gives me an opportunity to talk about one of the best slides I've ever seen. It was, I think it might have been from the Mental Health Commission of Canada, but I can't remember off the top of my head. Essentially, though, it's got um, like like a green, yellow, and red. Is
Okay.
that right? Or how does that go? Green, yellow, and red.
Yeah.
Um, and like every one of us, no matter what our basic mental health, whatever our mental health or health or emotional health is, we have our ups, downs, and middles, right? So you could have, and these things change. They change throughout the course of our lives, and even on a day-to-day level, even on a moment-to-moment level. You can be a supremely healthy person and have a car accident, fender bender on your way into
Yeah.
your webinar. Not that that happened to me today. It did not. Although I was worried about all kinds of things trying to get in here on time. But just like a moment like that and your stress goes up. So at the moment, your mental health is affected. You can also have somebody who has what a lot of people are going to say is like a more long-term mental health condition. Let's say someone's got what I don't know if they still call it SMI, serious mental illness, but if somebody has something like bipolar disease or schizophrenia, schizoaffective disorder,
Yeah.
something like that, but still on a day-to-day basis or on a month-to-month, week-to-week basis, people go through their ups and their downs. So just because you have an illness like that doesn't mean you're not healthy. You can be great, you can be doing great. And that's what recovery is all about.
Wow, that's really amazing, Carol. And yeah, I think now I am very interested to see how I can measure my mental health. I wouldn't say maybe on a daily basis, but like I want to find, is there like something which I can plug in on my head and then get the neurons firing up? Not yet.
I think I'm the wrong person to ask, but I can send you a copy of that image and you can measure for yourself.
Very good, very good. So, Carol, I am sure that all these government organizations and private not-for-profit organizations, they are really having a tremendous role to play in the society. And I truly believe that because of them, lots of prevention is already happening. And this is something that is great. And we're talking about communication. And now from the government and from the not-for-profit organizations, now let's just move to the business environment, right? And I am sure that many of our audience are either employees in businesses, or they are entrepreneurs, or even they are managers of several businesses. The question is, how can we communicate internally while minding mental health, right? How can we make sure that we are taking care of our peers, colleagues, employees, not offending them, not stressing them more? And in order to talk to that point, I would like again to share one of the uh, content which you sent me while preparing to this webinar. And tell me about safer language. Tell me about what we think, how we can handle this. But before that, I want to ask our audience. I am launching a poll now. If they can answer a little bit the questions while you are talking about the safer language in a business environment and in the work environment.
Oh, hosts and panelists can't vote. Okay.
Yeah, you cannot vote, unfortunately. So tell me a little bit about the safer language.
Okay, so this is a small part of a webpage from the Commission, the Mental Health Commission of Canada. And this is falling into what they call people first language. So the idea there, to go back a little to your question, is that if you want to create any kind of communication that supports the
Carol,
mental.
please, I want to ask you to put the microphone closer to your mouth
Oh,
because your
sure.
voice is really going a little bit low sometimes. Yes, thank you.
Okay, how's this?
Yeah. Oh, yeah. Now much better. Yeah.
Much better? Okay. So first you have to care about it. You have to know about it. You have to care about it. It has to be on your radar. And once it's on your radar, then you have a lot of opportunity to get the support that you need, whether it's researching materials, connecting with um, consultants who have experience and exposure, or maybe if you're in an organization, you might want to create a focus group among some of your staff to see how people are feeling about different things. So there is a massive trove of information for workplace and mental health supports if you go to that site, the
Yeah.
Mental Health Commission of Canada. I think I've said that. I should actually, when I get off this call, I'm going to call those guys. I'm going to text them. I'm going to say, listen, you guys have got to listen to this webinar because all I talk about is you.
So, like, for example, when I was looking at this kind of examples over here in front of me, I was really like, I had an aha moment, to be honest. Right? Like, even internally, when I was thinking, when even I talked to my friends or someone whom I met like recently, I don't know the background, and I just directly said, oh man, this drives me crazy, right?
Mm-hmm.
And now I
Me
am
too.
just thinking, maybe they had a case in the family, right? Would I be affecting them while talking to me? Would this generate a negative sentiment towards Mark because he's talking this kind of language? I don't want to hang around with Mark anymore. And then take it to the business environment and corporate environment. Sometimes you have colleagues or management that are not really in sync with the peers, and this could be one of the. I'm not saying it is the only reason, but this could be one of the reasons.
You know, I think the statistic is 1 in 5 people will experience a mental health challenge in their lifetime. 1 in 5 directly. So think about if we have 1 in 5 people in our community who have a challenge at some point,
Mhm.
those people also have families, friends, employers, members of their church, communities, um, gym, whatever, friends. So there's there's almost nobody in our community who's not affected by mental illness or mental health challenges. So that's right. We really have a great motivator to learn about this and to try to do our best to
Okay.
communicate respectfully. Yeah.
Yeah, I think this is really becoming very interesting at the end of the day because now I am trying to extrapolate, and now we're talking about the business environment. But during COVID, we are self-isolating, social distancing, working from home. So in a way, we are not really in touch with our colleagues and peers the way we used to be before.
Hmm.
However, we are now more in touch with them uh, in a digital form, right? We are either like now on a Zoom call, on a Skype call, on a Microsoft Team call, right? Or chatting. And then actually, again, I want to just highlight one thing which also we were discussing when we were preparing for this. And this actually one of my friends were telling me about it, that in real life, you talk and people listen. So from the sensory point of view, there is the verbal and the auditory senses that are really working. And then your brain is responding to it in a way. While when we are now online, it is more our tactile because we are typing, right? The way I express is more tactile. And then the way you get my message is more visual, right? It's mainly you read what I am typing, and then the brain is processing this differently. And one of the examples they said, oh my God, how this person was able to write this on Facebook, because they would have never said such a thing. And they said, exactly, this is the problem, because before we never say it, but we might be able to write it, right? So what is this impact? This is because pure communication, right? What is this impact? How can we um, make everybody aware about how to handle themselves first and how to mind the content while they are going digital?
And just to add one more example to what you just said, I noticed when I was on a Zoom call the other day, there was a pop-up message from Zoom saying you can comment, or you can communicate non-verbally by
Hmm.
using these icons. So that's yet another thing where we're not even using language; we're just using
Yes.
symbols. As how much can you say, or how much are you attempting to say with a thumbs up, smiley face, that sort of thing. Um, I mean, that gets into a whole interesting area, which is essentially how are we communicating? Uh, if we want to have an ethical um, approach to communicating, and if we want to follow certain ethics. I don't know. I think we've heard a lot of really embarrassing stories about people jumping up from their Zoom call, realizing they didn't wear pants. I
Yes.
mean,
Yes.
maybe that's part of creating a safe environment, is if you put your pants on before your Zoom call. Um,
Task number one, checklist: wear your pants.
I hate to say it, but I think it's mostly men who are not wearing their pants. I haven't seen any examples of women yet, so bit of a gender divide there.
Yeah, yeah. So when we go back to communication, so we all understand that there are, as you said, the verbal and the non-verbal communication, and then sometimes it's very tough to feel and to sense the intonation, right, from a memo, from a document, from a letter, right? Like
Exactly.
today,
Yeah.
probably recently, we see lots of memos from HR departments going to employees about working from home, about maybe doing the performance review remotely, doing, and then sometimes you might have like some, I don't want to call it harsh language, but very strict language, right? And is this going to affect us? Do you think, I am just asking a question out loud, like, is it going to affect some people's mental health when they see that there is a document coming, there is no intonation, I cannot see
Oh yeah.
the facial expression of a person who's sitting in front of me? So
Those
what can
that's the classic problem with email, right? Or
yes,
texts. It's
yes.
so easy for them to go wrong
Mhm,
because you don't have so many supports to communicate your message. Uh, Recently, uh, I noticed a major mental health program which had never been offered online.
mhm,
It was only offered live, has now gone virtual. And I spoke with some of the organizers of that program about a year ago, and near the beginning of the lockdowns in Canada, responding to COVID-19. And at that time, they weren't considering it. So the whole massive national program was stalled. And I noticed a couple of weeks ago that it's virtual now. So we're really forced. Our hand is forced to consider these things. What can we communicate online, and how can we do it responsibly? So in that case, it's a mental health program, and they want to teach people how to recognize mental health challenges
mhm,
in people. So somebody might be having a tough time, and this mental health first aid program is like to recognize, okay, something's happening there, some attention is needed, and then you can help sort of bridge that gap from the person having a need to finding services. Not that you're giving the clinical services yourself, but the point is, so much has happened with COVID-19. Everything's going digital, and I think we're still just in a time of exploring and discovering. I don't think we know yet, frankly, what the results are, how successful these things are, what is the quality of communication.
mhm.
That, I mean, right now here we are on a Zoom call. We're talking like this. Probably, you know, a year ago or 2 years ago, before COVID, we would have been sitting in two comfy chairs in a room together with people in a room. And there is a different quality of communication. So what does that mean? Where does that leave us? What can we live with? What are the limits of our medium, and what are our goals?
Okay, so in this case, we are like, humans or people like to communicate, like to engage. And now we see that some of us, including maybe myself now, like probably 1 year ago, I wasn't so visible online, right? Because I was having different means of connecting with people. But is there like a limit of how much to do it, not to over, like for example, I see people probably sitting live or doing live discussions every 10 minutes, or tweeting every 2 minutes, or posting on Facebook or on their LinkedIn account every 5 or 10 minutes. So is there a limit where also to handle not only our mental health, because I am sure there is, when we have such a behavior, this means that there is a need of communicating, right? There is something lacking, so that there is this urge of just staying connected virtually, right? But also I might be in a way stepping on the toes of the persons who are receiving my messages, and it will be like a little bit too much of Mark today, too much of Carol today. And then imagine it's like every day again and again. Then after a month, is there a chance maybe to lose friends rather than to gain friends? And then I would be in a slippery slope where I am already confined, I am already self isolating, I am already social distancing. And then because of my, I would say, lack of sensitivity about how to handle the digital environment, I start losing friends on top of that. So that tomorrow, if I want to go back to the normal life, I
Yeah,
have less friends.
that would be catastrophic, eh? Because then you're isolated at home, you're cut off, you can't go
Yes.
to work anymore, and you're still, if you're not able to successfully bridge that gap,
Okay.
that really leaves you in a bind. And then there's the flip side of that too, which is all the what is it? Doom scrolling, you
Yeah.
know? So I think people are so worked up and anxious that, and they're, I mean, let's face it, the last year and a half in world news, health news, uh, you know, it's been kind of a scary, unstable time. So people want to be online a lot, and people want,
Mhm.
I think Canadians are among the highest consumers of data, we're always online. We're connected
Yes.
all the time. I don't know what other people are reading. I'm looking at the news sites a lot, trying to stay on top of it. Um, yeah, it's a big deal.
And so what kind of recommendations you can maybe give me, for example, about how I can balance my communication online? Is there like a balance between what we call information or statements or requests or jokes? Like, sometimes people are just releasing the frustration by just putting tons of jokes every day, right? For example, or someone so focused and so anxious about their business, all what they talk about is about their business and their business and nothing other than their business. So what kind of recommendations you can give from a communication, written communication and digital communication to the audience, of how to balance their presence and lifestyle, and while minding their own mental health, but as well the mental health of their audience?
I think you'll be able to see from the various platforms that you're engaging on what the results are. So if you find that people are starting to drop you, you're posting every hour, Facebook post every hour, and people are moving away from you. You've got an
Mhm.
idea that that's not working out.
Yeah. Okay, that's interesting. And to go back to the government and not for profit. So not for profit are like definitely independent private organizations. Can you talk a little bit about any synergies between government and private sector about healthcare? Have you seen this already in your experience? Or do you think that maybe this is something new which someone or you or us or whoever should start really talking about building a stronger communication that is a common message, and the message between the government and the professional organizations and the private sector?
Well, I think one interesting thing that's happened in the last several years is that uh, we have been measuring the effects of mental health on the workplace. And so we know that a great number of people are out of work every day across the country,
Mhm.
in the millions of people. Um, it's a massive number of people, and it's a massive amount of money that's lost to the business world. So that is a big motivator. I think I kind of hate to say it. I'd like to say that businesses are beginning to lean into supporting their employees' health because it's the right thing to do. But I
Yeah.
think we're also seeing that businesses are recognizing it's hurting the bottom line when so many people are out um, on mental health leave, or like having a sick day. Uh,
Okay.
and we're also seeing a lot of big businesses like TELUS and Bell. Bell Let's Talk. That's a massive
Yeah, they
program.
did the campaign a few days ago, right?
They have a yearly campaign,
Mhm.
and um, they encourage people to talk about mental health issues. So that's kind of good for business in a way because it positions them as a virtuous organization. I'm sure there are also virtuous reasons for doing
Yes,
that, but
yes.
there's also I think a benefit to the business as a business to doing that.
Wow, that's I think this is a like the like companies like Bell and many similar companies who are really doing this kind of awareness campaigns are really um, important for us. It's important for our community, for our own. I will start from our own micro community, which is just the neighborhood, to the macro community, which is our city or province, and then we go even at a country level, right? And then at a regional level, because I think being online and communicating online and continuing what we're doing right now is not going to stop anytime soon,
No,
right? And yeah.
it's really exciting, and those big organizations like Bell that are engaging these huge campaigns, they are affecting the national discourse.
Yes.
And I'm happy to say it's not just in Canada. It's around the world. A lot of conversations are happening about mental health supports
Yeah.
and supporting people in community. So uh, you know it's not that long ago that people who had serious mental health problems were really shunted off, hidden. And I mean, those are real human rights
Of course.
concerns, right?
Of
So, we still have a long way to go, but we've come a long way too. And it looks like there's no stopping on that. So
Definitely.
that's good.
We have a comment on Facebook from KJ saying, I think people did not know how to be virtual. People are gone more stressed because of online dealing with employees. There should be an awareness program or certification on how to manage teams online. What do you think about that?
Yeah, that's a great idea. And maybe by putting in place a few general practices based on mental health supports, creating a healthy mental health, a healthy uh, corporate or
Yes.
workspace would really be advantageous there.
Yeah, I totally agree. I think, and actually, 2 days ago, I was in a discussion with someone from a business environment, and we spoke that last year in 2020, because of the chaos and the uncertainty and the sudden impact of COVID-19 on us, everybody jumped into the digital environment just because we had to do it, right? No one really thought about it. Many of us were not even prepared, right? Many of us didn't have the equipment. And then all of a sudden, everybody went and purchased the equipment. And then all of a sudden, we don't know how to use the equipment. So we needed some training over there. So it was like more chaotic, right? I don't want to even call it the organized chaos because it wasn't yet an organized chaos, but it was more chaotic. However, now we feel that people are taking a step back and say, okay, now it's our new normal. So how to handle it? And also we have a question or a comment from Marika on our Zoom chat saying that I think a professional communication person can bring a level of emotional intelligence to the scripting of public education messages. Most people in government are skilled and outward messaging on sensitive topics. That may not be the case for some of the corporate organizations, and this is where people like Carol can be of assistance. Whoa, thank you, Marika. I think I will be talking to Carol anytime soon, right? Yeah, I think we all agree, right, Carol? We agree with Marika that the corporate environment is, to a certain extent, I wouldn't say everybody, right? I am sure many organizations are really putting lots of effort, and we thank them for doing that. But maybe the smaller organizations are not really thinking about that. So how, like, if I am to come for professional help in terms of bringing a communication expert to help me in my communication regarding mental health in my organization. And since Marika mentioned it, that you can be of assistance, so how can you be of assistance? How can you help me? What would you do for a company like mine, or like other smaller companies, like entrepreneurs, startups, small medium enterprise, family businesses? Because I think, you and me, we are part of the Family Business Association as well, and we are sending just a kind our kind thoughts to this great family. So how can you help us?
Yeah, so the place to start would be to look at where you are and look at what your goals are. And some of this stuff is just very common to all communications and marketing efforts, really. Uh, what are you working on? Where are you going? And bringing in that sensitivity and that awareness of mental health issues. As you said,
Mhm.
for a great number of people, maybe they've never thought of it. Maybe they've never prioritized it. And potentially a business wouldn't see the benefit of actually even doing it. So then looking at how does the mental health environment at your organization affect the the culture, the productivity, and what can you do to make it better internally with your group and externally with your customers or your end users, whoever they may be.
Wow, yeah, yeah, that's really good. You mentioned something that is very important, that we need to know the objectives. And again, I go back to something which you said earlier,
Hmm.
the audience. To whom are we talking? Are we talking to customers? Are we talking to employees? Are we talking to partners, vendors, suppliers, right? Are we talking to our financial institution, right? So,
Yeah.
and I totally agree with you. We need to have a better plan, or at least to be aware of how to handle these different situations. That's really amazing. I just want to remind all our audience that we still have like maximum 10 minutes. So if you have any more questions to put on either our live feed on Facebook or on Zoom for the ones who registered, you have also access to the Q&A session. So please feel free to drop your questions before we start wrapping up the session. Um, uh, so Carol, actually, this is like a good segue for us to start saying or doing a summary of uh, of what we discussed today.
Hmm.
So if you are to summarize the situation of minding mental health through digital communication, and if I want to put it on a scale of extremely bad from awareness to great in awareness, where would you put it on this scale? And what are your 2 cents about how we can make it better?
Where would I put what on the scale? What?
The if the awareness about communication, online digital communication,
Oh, I
and
see.
minding mental health through communication, if I
Hmm.
say the awareness is going from like very, very bad,
Yeah.
extremely great, where do you put it on the scale?
I would say before COVID, I'd put it sort of on the lower middle side, but because of COVID, and everybody is becoming so aware
Mhm.
of the stressors that people are experiencing, and the tsunami of mental health challenges that are predicted to result from all of these topics: isolation in the community, losing loved ones to this illness, to this virus. We saw earlier so many companies closing their doors and or scrambling to survive. All of these things are stressors on mental health. And that is all front and center now. The Canadian government is pouring millions of dollars into a variety of mental health supports.
Yeah.
So it's there. I'd say the awareness is probably, between middle and maybe closer to high right about
Oh,
now.
wow.
Yeah,
Wow,
that's what I
that's
would say.
great.
Yep. That's my evaluation.
Wow, that's really good. Coming from an expert like you on the matter, I think it's good. I was maybe expecting that you would say we are a little bit below average. I wouldn't say it was a disaster because we see many things happening. Uh, there is one more comment on the Q&A is I am concerned with seniors who don't have the online experience to listen to webinars such as this or to connect with the rest of the world. This is from an anonymous attendee on our Q&A. Thank you so much. Yes, I agree with you. Unfortunately, it's tough. They don't have the access to the digital environment. On top of that, with the social distancing, no one is able to go to them to do an awareness campaign live face to face as well. And they are, yes, completely disconnected, unfortunately. Just one more thing for the audience who is with us on Zoom. I just launched the final poll about your satisfaction level about this webinar. So please, I kindly ask you to reply to that. The poll will be closing in the next minute or so. Uh,
I'd like to just say one
yes.
thing about that comment that you just shared,
Mhm.
which is that is a great example of why internal policies are so important. Because let's say you have somebody like my aunt in Ottawa who is in a senior's residence, cut off. She had COVID. A bunch of other people there had COVID. Nobody could go in, and so, like you saw in the news, family members were going to the window, knocking on the window and waving. Um, so that alone is one little piece that could make no sense without context. So the staff inside have a huge role in providing the context and
Mhm.
providing the safety, the psychological safety for the people in the organization. So what does that mean? That facility needs to have great policies, great um, employee handbooks, all of the supports, whether they're memos, posters, all of the supports have to be in place for those staff to be able to do that job well in that urgent urgent what do you call it, pressing
Yeah,
situation. Yeah,
very good.
so that's why an organization needs to have their materials together.
Very good, very good. Thank you so much, Carol. Carol, I think we are now reaching towards the end of our discussion, and I just want to. There is only one last question which I am taking today before we end up. There is one question from Anastasia on Facebook saying, "What have changed in the mental health communication since COVID started, and it's affecting us? Did the priority in the messages and communication shifted? Have you seen any shift in the priorities about the messages or the content that is going out during this period?"
I would say that from what I've seen, uh, looking at the communications from a variety of organizations through either mainstream media or through organizations' websites. If I take the example of the government of Nova Scotia, there's a lot of emphasis on it. So there's a lot of real estate, you know,
Yeah.
available to that right now, and that has not always been the case at all. Usually, health, the health environment as a whole doesn't always have the resources it needs, and mental health is always at the bottom of that. Mental health programs, uh, psychiatrists, doctors, communications people, they're kind of at the bottom. It's unfortunate, but it's a continuation of the stigma that we see mental in the mental health world. So the fact that there is communication and so much communication up front is really, it's encouraging, and it's also, I guess you could also say, it's pretty telling about
Yes.
the importance of the situation.
That's good. At least we see that things are going in the right direction, right?
Mhm.
uh, just one final comment also on the Q&A. An anonymous person said, everyone is telling us to go online. I try to be open, but when everything I want to find out is go online, it makes me angry. I
Mm.
totally agree. I totally agree, because everything is online, right? At some point, if you don't have a screen, you don't exist anymore. But guess what, we had this kind of discussion also actually yesterday with one of my friends, and then we said, so we're supposed to do a Zoom call, and then yesterday we had a very bad weather, and then the power was like flickering, and then someone said, let's cancel the call. I said, but wait, we still have phones. Why we cannot do a phone call? Like, if Zoom is not working or internet is not, so we completely forgot about the simple habits, right? Like, even if it is not face to face, like now phone calls are not enough anymore. Wow, right? It's like, it was like really an aha moment for me.
Right. Yeah, I think about how I can't live with Zoom anymore. And this is brand new, brand new.
Yes,
But
yes.
just to one other, I don't know if this can be an encouragement for the person who left a comment, but depending on where they're located, uh, some areas you can still meet in person, and that's also like the telephone, something that we forget, uh, that from a distance, like you could go for a walk outside, where you're 6 feet apart from somebody. You can still have those. What did we call those at the beginning of the pandemic? Like, there,
But the
walk,
yeah, yeah,
go
the
for like a 6 foot coffee date or a 6 foot walk
yes, yes, yes.
on the trails or something like that. But yeah, that's right. And everyone's got the Zoom burnout, so
Yeah.
it's good to remember what other resources are available. Letters? Does
Of
anyone
course.
remember how to write letters?
No, I don't. Actually, maybe people don't have a pen anymore.
I
I
know.
don't know,
I've
right?
got a Sharpie. Well, that's pretty coarse.
Very good, Carol. I think it's time to wrap up,
Okay.
and if I want to just give my quick summary, I think we are in a much better shape than I've thought about awareness around mental health, and especially about the communication part around mental health. um, I still feel that there are lots of things to be done, especially in the corporate environment. I think from the government and the specialized organizations, they are doing a great job, but I am not saying that they should stop. I'm not saying that they should stop improving. I am not saying that they should do more, but I think they are much more advanced than the majority of the private sector. And when I talk to private, it's more like smaller enterprises, smaller organizations, where sometimes they are firefighting their own business all day long, right, to survive, especially in this crisis. And sometimes we just tend to forget a little bit about mental health. We are too pushy. We ask our employees to do too many things, work longer hours. Yeah, and unfortunately, I cannot pay you overtime. I cannot pay you a bonus because it's a bad economic cycle. But still, I am asking you to give me more and more and more. And then where this stops and what is the impact on the mental health of the whole organization after that. I think this is where we need to mind it, especially in terms of communication, explaining more to the employees why we are doing it, explaining more to the management why we are doing this, so that we have more peace of mind, I would say, in the work environment.
Yeah, I would agree that that it's definitely got to be a priority among the other things, getting the finances and everything together,
Yes.
getting the mental health positioning
Yeah,
together.
definitely, definitely. I don't know, Carol, if you have any final words to say about the topic. If not, we can now wrap up and thank our audience for being with us.
I would just say it's attending to mental health in the workplace is so important, and in the community, and we can do it, and we are doing it, and we're finding all kinds of great ways to do it. The two resources that you shared earlier, jack.org and the Mental Health Commission of Canada, they
Yeah,
both have great websites with great examples. So much wonderful work is happening, and so I encourage people to think about it and to look around. Um, and certainly, if anybody wants to continue a conversation with me, I'm available. You can find me at healingtreecommunications.ca or on LinkedIn. And
very good.
I'm just really happy to be here. And thank you again for the invitation, Mark. It's been a wonderful experience.
Thank you. Thank you, Carol, for being my guest. It's an honor to have you and all my guests with me, because I know that I take a lot from your time, and but we try to bring an interesting topic to our audience. So thank you for all the participants, everybody who was with us on Facebook or on Zoom. Thank you, Tara. Tara said that it's a great talk. Thank you, Tara, for being here. I want to thank everyone again. I want just to tell you that we are having our live webinars every week, every Wednesday at 12 p.m. Atlantic time, 11 a.m. Eastern time. All the lineup for February is already on our website. You can go to Strategy Up, mystrategyhub.com, and you will find everything there. It is available on our social media as well. And the calendar for March will be announced in the next week or so. So we already have a full lineup for March as well. Lots of interesting talks are waiting for us. So please stay tuned. And I want to thank you all for your time. Thank you, Carol, one more time. And I please, if you have any questions around mental health and you don't know how to reach Carol, reach out to me. I am the mailbox. Don't worry. Everything will reach out to her, and she will be in touch with you as well. So thank you so much. Have a great afternoon. And I hope that I will see you on our next webinar next week. Thank you all. Bye for now.
Thank you.